Hello, everyone. This is Dr. Renee Young of Young Naturopathic Center for Wellness in Los Gatos, California. Today, we're going to talk about one of my favorite topics, hearts and private parts, because they're not just related in your bedroom; they're also related in your body. So I love talking about this with patients because they really get this part of our healthcare as being so important. So our sexual health and our cardiovascular health are really related. So hormones are produced, obviously, through a certain period in our life, from puberty to menopause in women. I call it menopause in men, or andropause. So during this time in our life, our hormones are at an all-time high. Now, I'm going to take you guys through a couple of exercises. You're going to really need to pay attention here. I'm going to take your finger. I want you to touch the tip of your nose. Okay? Are you guys doing it? I see one of you not doing it. You need to do this. Ready? Touch this. Okay, cool. I got it. All right. This is what your insides feel like before you go through andropause and menopause. This is what they feel like afterwards. Boom, 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 boom. See that? So things start to sag. God, guys, I'm sorry. It's not just our faces, it's our insides too. So parts and private parts. Hormonal decline ends up having less elasticity in our blood vessels. They don't move as easily. They become harder. They become stiffer. They're not as fluid as they were when we were younger. So keeping up with our hormonal health can often keep a more youthful cardiovascular system. So I know some of you are saying, wait a minute. I've heard they can make things worse. Well, part of this is kind of true, but what are you saying, Dr. Young? Better, worse, what's the difference? Well, in order for me to explain that to you, I have to back up and tell you a little historical fact. So somewhere around 2002, and I believe it was on, a show that was by Oprah. She jumped on television and she said, ladies, get off your hormones. It's causing cancer. And at the time, that seemed like a very plausible, intelligent piece of information. And I love Oprah. So I, thought, wow, she must know something. She uncovers a lot for us. A lot of people did. So women and men stopped taking their hormones. And we did see an increase in some cardiovascular issues. So I feel like cancer issues have been pretty defunct when it comes to hormone replacement therapy, with the exception of women who are taking estrogen with unopposed progesterone who still have a uterus. So we do see some increase in uterine hyperplasia, but hey, ladies, guys, prostate cancer, breast cancer, they're common. Take hormones, don't take hormones, it doesn't really seem to matter. 1 in 8 of us will have either prostate or breast cancer at some point in our life. Not kidding. Check my facts, look it up with the CDC. So we've seen evidence over time that people that maintain their hormonal health, they don't have the increased risk of cancer that we previously thought they did, and they do have an improvement in cardiovascular health. So why the conflict with all the data? Well, it's just like anything. Let's think about this like red meat, okay? Some people say red meat is really good for you. Some people say it's bad for you. How come no one's saying, what about the quantity? Like, I can't sit down and eat a whole cow, but if I have a little bit of a steak, it's probably good for me. But if I have a lot of it, it's probably bad for me. Well, quantity of things is really important. So quantity of hormones is important. I know I have a couple of friends right now that are medical doctors. I totally love you guys that are still saying, I never test hormones because it doesn't matter what they say. They change. So therefore, I don't even test them, I just prescribe them. Well, we have reference ranges for a reason. So a patient should fall within a normal range. Maybe normal for them is a little or higher or lower on any given day. It's our job as a doctor to not make an emotional decision over your hormones. It's to give you the information of this is the range they should be in. So when we're checking on someone's hormones to help improve their cardiovascular care, we both check their heart health and their hormone health. We look at inflammatory markers. We actually even look at your genetics before you go on hormones. Did you know that there are a couple of different genetics that you might have that would increase your risk of cardiovascular disease and even stroke? That being on hormones could make that worse. So many of you may know, but most of you won't, that the most common side effect of birth control pills that is horrifying, not the most common, but the most common horrifying side effect is actually stroke. My first patient who had a stroke was a 32-year-old that had been on birth control since she was 15. I am not advocating that you get off of your birth control. Let me be very clear. Stay on that stuff. But if you're on hormones, you should really make sure that your blood is sufficiently thin, that you don't have those risk factors for heart disease. And if you do, you need to balance out your hormone health. So, what we learned so far is that hormones affect our cardiovascular health, and that your blood vessels feel like this before your hormones decline, and they feel like this afterwards. I know some of you will never get that image out of your mind. You're like, damn, my insides are falling too. Why? I can't stand it. So now that we've kind of covered those things, and we know that our vascular health is related to hormones, how are you going to implement hormones to help yourself to age better, to help yourself feel better? 55% of us will actually succumb to cardiovascular disease. Remember, that's actually how I want to go. I don't want to go out in any kind of, horrific disease way. I just want to properly, over my 100th birthday, hopefully closer to 110 of cardiovascular disease. So if you're a person who doesn't know your cardiovascular risks, you don't know what your hormonal status is, I'm going to deeply encourage you to find that out. And don't end up with a practitioner that just says, meh, I don't care. Everyone gets the same dosage. I've seen women put on testosterone pellets and their blood gets thicker, their iron levels go up, their fibrinogen goes up, their C-reactive protein goes up, and suddenly they're at risk of a heart attack. Sure, they want to make out with their significant, or no judgment, even your not so significant other, I don't care who you want to make out with, they definitely want to make out with people. Their brain is game on, they feel really great, but if they have a stroke from that, isn't that a problem? Isn't that our responsibility as your healthcare provider to make sure that you're safe? It absolutely is. So seeing someone that understands hearts and private parts go hand in hand is so important. I'm not just talking to women, I'm talking to you guys too. I actually see it even worse in men, where their muscle tissue, because of such high testosterone, should break down in order to look like super buff and strong. Your muscles have to break down and reform, but then their blood gets thick. And no one's advising them of just simple, silly things like, hey guy, just take a little more fish oil, take some garlic, do some things to thin your blood so you can mitigate the negative effects that could happen. So you only get the positive effects of having your blood vessels nice and, supple. And, it's almost like, I think like if you put a fork in a sausage, that's who the outside of your blood vessels should be like little pop. They shouldn't be all mushy and gross, right? So we want them to stay really, nice and strong. So get tested, look at all of your cardiovascular stuff, look at your sex hormones, and then also look at your risk factors. I like to tell funny stories to my patients, and I'm not going to tell you the full story. You'll have to ask me in person. But I have someone that I thought was my aunt for many years, and I learned later that she was just another random Italian lady that used to give us, candy and stuff when we were kids. It was a good friend of my grandmother's. So family history is sometimes a little bit sordid. So I included her in my family history for years. I'm sure some of you also don't know your family history with great clarity. If you ask your family, it's always helpful to figure out what someone passed away of. This particular aunt died of fear in the night. I assume she drank herself to death. That wasn't what the truth was. She actually had a heart attack, but she also wasn't really my aunt. So it's a whole funny thing. So ask your family, what's your family history? Family history of heart disease is a good reason to look at your hormonal health. So if you have a lot of, heart attack and stroke in your family, you might want to look at hormonal decline. How many of you have gone through menopause and then your cholesterol starts to go up? Why is that? Your liver actually produces cholesterol in response to ovarian and testicular decline to help you make your hormones. Wait, what? Cholesterol can have a hormonal relationship? It absolutely can. So this is where we get more into the, hearts and private part stuff in your lab work. How can I know that from just looking at you? I can't look at your pretty faces and know what problems you're going to have. We have to ask your family, we have to look at your genetics, and we have to test you where you are right now. So baseline testing in your 40s is so important. If I don't know what's normal for you now, I don't know what's different later. So I really want to make sure, and I encourage you guys to get a baseline. If you haven't yet, it's no worries. We can still look at you at any age and figure out if your hearts and private parts are having any kind of disagreement where we need to correct one so the other feels really good. I'm looking forward to meeting with you guys, going over your personal labs. And this is such a cool topic. I wish I could talk to you about this for hours, but you'll definitely hear more about this from our office. Looking forward to seeing you soon.